is it's a very simple procedure, and you have less scars. A lot of people worry about the scars, but more than that, it's a fast recovery. So the hospital stay time is minimum. And when we do the minimally invasive surgery or keyhole surgery, we have much better view of what's happening.
We all believe in not only getting a good medical science treatment, but we also believe in taking care of our body post-surgery. Because of which the conventional surgeries of open cases have now been replaced with keyhole surgeries. And for that, we have our expert today, Dr. Nikita Trehan, who will brief you on what has happened in the past few days and what wonderful thing was done and how the patient is recovering.
The fibroids are basically estrogen dependent. There's a female hormone estrogen which is in genetically predisposed women. Like in blacks you find that it is much more than the Caucasian women. So, and when they don't get married on time and they don't have their babies on time, then if they remain unmarried for quite some time, then these fibroids keep on happening. They keep on increasing. And multiple fibroids is another. We have another record. We've removed 300 fibroids from one patient in India again. So that was from Egypt. This lady had come to me in India, and that time I removed 300 fibroids from this one lady. Yeah, the fibroids again are very notorious. They keep coming back again and again, especially multiple fibroids, small fibroids. So when we do a dual, the recurrence is 96% don't come back. There is a very high chance that it will not come back ever again, because we are blocking the blood supply to the main arteries of the fibroid, not of the uterus. So the excessive blood supply which goes to the fibroids is cut off, but the uterus continues to get its blood supply, and that is why when this girl gets pregnant, she will not have a problem. And there are other methods which have come, which have gained popularity by UAE, uterine artery embolization, and high intensity frequent focused ultrasound. These were non-invasive methods which had come, but again they are very sort of in the initial phases. And uterine artery embolization, once it is done, you cannot have babies in the future, because that is only done once the family is complete. Why should we push laparoscopy so much? Why are we going on saying laparoscopy, minimally invasive? And we take great pride in being one of the pioneering institutes in minimally invasive in all branches of medicine, not only in gynecology, in general surgery, in neurology, in every branch, because of the advantages it offers to the patient. The patient is minimal pain, minimal blood loss, 1 day's hospital stay. So minimal hospital stay, and especially in gynecology where women are the key people in the house, they make a home, a family. These people need to get back to their day-to-day activities really fast. So they can actually go back to everything within 2 to 3 days. They can join back work maximum within a week, even if they're sort of wanting to take it easy, a week. Compared to open surgery, where they are there in the hospital for 4 to 5 days, they need to go back, they have a lot of pain post-operatively. On pain scores, we find that usually the pain score is only 1 or 2 the next day after the laparoscopic surgery, compared to 8 or 7 after an open surgery. Blood loss, we rarely need to give a blood transfusion, and you'll be surprised in a 3 kg fibroid which is removed, there's no blood transfusion which is given, which is unimaginable after an open surgery. Because to open the abdomen only would take approximately 400 to 500 blood loss is there, ml of blood loss is there. side effects is if you don't operate, that is a side effect because there is a fibroid, it needs to be treated. If you don't treat her, she'll keep on getting anemia. She'll keep on having problems. Infertility will be an issue. So it needs to be treated. The only other method of treating it is open surgery. But open surgery has so many side effects that it's much better to do it laparoscopically. The only thing is the surgeon has to be trained. If it's done by an untrained person, then it's like saying that what is the advantage of going from point A to point B? Would you travel 28 hours by a car or would you go take a 1 hour flight? Yeah, the pilot has to be trained, sure. If the pilot is not trained, then you're dead. That is the only difference. This surgery is more cost effective compared to an open surgery because after an open surgery, you're taking work leave for 2 months. You're not, other things are there. There's so many other things which contribute to add to the hospital bill is there for 5-7 days. Whereas this, you're going home the next day. So, and you can get back to work. It depends on your own pain threshold. If somebody I pinch, they will jump up. If another person I pinch, they will say, nothing, I don't feel anything. So the usual pain threshold is there that people usually join between 3 and 4 days. They can join back work within 3 and 4 days. For somebody who has a pain threshold is different, they may take 2 weeks. But I have not seen anybody who's needed more than 2 weeks to join back work. We have special machines called morcellators. That this morcellator, if we're taking it out, with the morcellator we can take out any size of the fibroid with laparoscopy.
What are the precautions that the patient should be taking before the surgery is done? Actually, ideally, if she has menstrual problems, we do try to give her some injections or some tablets where her pre-op hemoglobin is optimized. That means we like to build her hemoglobin up so that we do not need to give her blood transfusion because some blood loss will be there during the surgery, so we should not need blood transfusion. Ideally, we don't want to do such big sizes. Why? Because patients should be aware, they should be able to diagnose it earlier. I mean, when you feel a lump in your abdomen, you should be able to go to the doctor and let it not become so bad or so big that it becomes a challenge for the doctor. I mean, it is a challenge when we do such big cases. I have done a 3.9 kg in India where the lady went on to have a normal baby after a year. A cesarean section was done and a 3 kg baby was delivered after a year of the myomectomy. So, I mean, we don't want to do such big cases. We would also like to do a 5 centimeter fibroid or a 6 centimeter fibroid because then it's really easy to do those kind of fibroids. A larger fibroid is a constraint because there is only that much space in the abdomen and it becomes, for the surgeon, it becomes extremely difficult as the size keeps on advancing. We do have the expertise to do it, but we would, for the media, expect that they should help us in creating awareness so that patients don't make it reach those sizes. So what is the advice that you give to the patients once the operation is done?
Once the surgery is done, especially in unmarried girls, I do tell them, please get married. Please have your, now that you are corrected, you are ready to have a baby, all your problems are over, so have your baby now. I mean, after 2 months, not immediately after the surgery, we advise them to have a baby after 2 months, get pregnant after 2 months of the surgery. For 2 months, we advise them not to get pregnant, so that much healing, the stitches on the uterus should heal in that much time. And the thing is that we also tell them that they should carry on their day-to-day activity. The sooner they move after laparoscopy, the more comfortable they will be. Because after open surgery, they advise rest. So that is gone in the head of the patients that we should keep resting. We tell them that please work, go join back work faster because the only pain our patients feel is if they were constipated or gases. So once they are mobile, then they are not constipated, then they can resume work faster.